have had so many questions of people asking me, what are the essential things that nurses have in their backpacks? What are the most essential things that you would want to take to work? And this is I'm going to be showing you all what I take to work that makes my shift easy peasy and makes my shift convenient and smooth sailing. Stay tuned and you would want to see everything that's in my work backpack. The very first thing on my list, which is not necessarily in my backpack, is going to be my shoes. I cannot even tell you guys how many hours we spend on our feet, from cleaning the patients to giving the patients bed bath to maybe starting IVs, hanging IV medications, or maybe, sometimes you would have to document whilst you're in the patient's room when you're giving medications. Sometimes you even have to, maybe during a code blue, you have to be standing. There's so many things that we do as nurses that entails us standing on our feet, and so your footwear is one thing you would want to make sure that you are investing some pretty coins in order that you are much more comfortable on your feet. And so comfortable shoe wears is one of those very important things that I know that so many nurses invest a lot of money in getting them, from Crocs to Nike to designer wears, Skechers, Adidas, you can name it. There's so many brands out there that nurses love to always go for. So whatever you can afford, it doesn't mean you have to go for the Nike. Get what you can afford. I always advise, especially like new nurses, go for the Skechers, go for the footwears that are affordable and which you can get from Walmart. And then as you progress in your nursing career, if you can afford it, if that's something you want to go for, go ahead and purchase it. But I will tell you that those expensive designer Nike footwears are not necessary. You can get whatever you can afford and whatever you feel comfortable in wearing. And so make sure that you're taking care of your footwear. Make sure that when you get home, especially even when you wear these comfortable shoes, you want to make sure you're giving yourself a very good massage. So make sure that foot care is one of the things you're engaging yourself when you get back home. You want to make sure you wash your feet, you dry them, you kind of massage them gently, of course, and make sure that you feel relaxed after your foot care session. The next thing that some nurses will use are compression socks. I do understand not everybody likes the feeling of compression socks, but the medical reasons why some nurses go ahead and use compression socks is that they're trying to avoid the formation of varicose veins on the back of their feet, which can lead to blood clots and which can lead to complications of breathing and strokes in worst case scenario. And so compression socks really come in handy because since we nurses stand a lot whilst walking, the blood tends to pull down to the back of the feet, and they can actually just pull and stand there and form these blood clots. And so many nurses love to wear compression socks so that it keeps the blood circulation in the foot pumping, and that will prevent the blood clots being formed in the first place. I know that I don't like the feeling of compression socks, but there are some nurses who can die for it and who can vouch for it that it is their right or die. So if that is something that you're comfortable using, go for it. The next thing on the list is going to be a stethoscope. Most nurses would have a Littmann stethoscope. This is kind of like the standardized stethoscope that most nurses will have. I know that there's a cardiology version, but this one is the Littmann, I believe Littmann 3. This is what most nursing students also have. Don't pressure yourself to say that you want to go ahead and get the cardiology Littmann stethoscope. A Littmann stethoscope 3 is very, very efficient. It is as good as any other stethoscope that you can get out there. So a stethoscope is one of those very important equipments that we nurses use. I know that sometimes when people see nurses with a stethoscope, they think that we are trying to impose or make ourselves feel like we are very important or make ourselves feel like we are doctors. But let me tell you all, there is something called nursing assessment, and there are two assessments that you must use a stethoscope. One, when you have to assess if a patient is constipated. If a patient is having an active bowel movement, you would want to use your stethoscope to be able to listen to the bowel sounds in the belly. That is how we know that a patient is not constipated. And the second thing is you want to use this to listen to the patient's lung sounds. You want to know if the patient is having crackles, if the patient is coarse, if the patient is having wheezing, if the patient is having a stridor, which will entail that the patient is in an emergency situation. And the third thing is also going to be, you listening to the heart rhythm of a patient. So a stethoscope is going to be the appropriate equipment you're going to use when you're doing your nursing assessment on a patient, especially if the patient comes with respiratory issues. You want to use your stethoscope to be able to listen to the lung sounds. If the patient comes with a cardiology issue or with a cardiac issue, you want to use your stethoscope to listen to the heart sound. sounds. If the patient comes with maybe some bowel obstruction, or if the patient comes and the patient is constipated, you want to use a stethoscope to listen to the bowel sounds of the patient. Next thing on the list is going to be scrubs. Obviously, there's no way that we can go to work without wearing our scrubs. I do understand that scrubs might not be standardized in every hospital, in the sense that not every hospital endorses nurses to wear scrubs. In the hospital where I work currently, sometimes some nurses will wear t-shirts and you wear a professional looking pants and you are good to go. As long as you're looking professional, as long as you're not looking like some regular person on the street, you're okay to come to work. So the very big thing that all nurses are going to have, like every nurse I know has scrubs, and it doesn't matter what kind of scrubs you take. I know that some people want to indulge to get like the fig scrubs, some want to get the Cherokee, some want to get the mandala scrubs. I'm not in any way advertising them, I'm just calling the normal or the most popular scrubs that most nurses have. But you don't necessarily have to buy the expensive scrubs, because I can tell you that the scrubs that are being sold at Walmart still function the same thing as the fig scrub. There is no difference. Probably the only difference between the fig scrub and the Cherokee or any other scrubs out there is that the material or the feel of the fig scrub is very soft and very soothing on the skin. That is the only difference I have found with my fig scrubs, because I have fig scrubs, and that is the same feeling I have with my mandala scrubs. So there's no difference in the kind of scrubs you wear. Look at it that you're going to work to go perform or to go care for patients. No patient is going to remember what uniform or scrubs you wore, except maybe, for example, something spills on you in front of the patient, then will they remember what you wore. But most of the times, nobody will even remember what you wear to work. So do not stress yourself on what kind of scrubs you wear or the brand that you wear. That is not necessary. Get whatever scrubs you can afford, wear it, go to work, care for your patient, come back, wash it, and repeat the cycle. A scrub is a scrub. Next thing on the list is going to be a pen light. This is a pen light, so it has these circles on it. The circles are going to tell you the size of the eye pupils, and the pen light has a light, as you can see. So this comes in very handy when you are assessing the neuro aspect of a patient. If a patient has a stroke, or if the patient has like a brain injury, or if something has happened to the patient that you need to see or assess the patient's consciousness, or if the patient has had anything that has to do with like the nervous system, a pen light comes in very handy. Because I am a certified stroke nurse, this is a very, very important equipment that I always have with me every day that I go to work. I always have it in my backpack, and so this is one thing that I cannot go to work without. So we use the pen light to assess the patient's eye pupil in terms of the size, and you can measure it from this ball in terms of the size, and also assessing to see if the patient's pupil is reactive to light. And also when you're doing your stroke assessment, you will use it to like move it in front of the patient to see if the patient's pupil or the patient follows the direction of the pen. You can use anyone to see if the patient follows the direction of the pen, but because you're holding the pen, you can just go ahead and just use it whilst you're doing your stroke assessment with the patient. So the pen light to see if the patient's pupil reacts to light, and to assess the size of the patient's pupil. This also comes in very handy if you suspect that your patient had a narcotic overdose. If a patient has had a narcotic overdose, you're going to see the pupils constricted, meaning that the round circle in the eye is going to become very, very tiny, probably as tiny as the last circle that you see here, the smallest one. So that is a telltale sign that the patient has had an overdose of maybe fentanyl, oxycodone, tramadol, Dilaudid, or whatever narcotic the patient is on. And so this is where this pen light comes in very handy, because you will know what the patient's normal pupil looks like. If you suspect that the patient has had an overdose, when you see the size of it, it's going to be so pinpoint, as we call it in medical science, you will be able to easily tell that the patient has had an overdose. So this is a pen light. It comes in very handy for the neuro aspect of assessment for a patient. So whilst we're talking about the pen light, I would just go ahead and mention my pens. I like to have multiple pens. Many people say that one of the things that nurses will always misplace is pens. I will agree, I would deny. Sometimes it's going to be easy to lose your pen yourself, because maybe you might go into a patient's room, you write something, you forget it in the patient's room and it's missing. But sometimes nurses will just go ahead and grab other people's pens, use it, and maybe forget to return it back and they take it home. So I always love having multiple pens. As you can see, this is a pencil. Sometimes I love to write and be able to erase it. And this is an erasable pen. This is in the color black. But the most important pen I love to always have is this multicolor pens. Somebody made a joke that the Gen Z nurses will never understand this kind of pens from the older nurses, and how important the older nurses found this pen, because back then when everything was paper documentation, these pens were very, very important. You use the different colors to be able to highlight certain things. You use the different colors to be able to highlight maybe some changes in your documentation or what you want to really stand out. But I really love these colored pens, because let's say if I have a 3-day shift back to back, when I start the very first day, I love to use the black color ink or the blue. When I come the next day, I'm going to use the red, which means that this is the new thing that happened for my next shift. And then the next day I can use the green. And then the next day, if I use the first day the black, I can use the blue. So these different colors now will tell me that, okay, the previous potassium on the first day was probably 3.5. Now the patient's potassium is 3.2, and I'll use a red pen. And then the next day now, because they replaced it, it is now, who knows, maybe like a 4.7. So potassium has been fixed. So that keeps me in track in knowing to be able to easily pick out what is important and what I need to focus on. The next is going to be my erasable marker, because we nurses have to be able to communicate the plan of care to the patient by writing everything on the board in the patient's room. We always use the marker, which is temporary. We can wipe. I always like to have my personal one for myself, because sometimes you go to the nursing station and there is no marker there, and so just having yours handy just makes your shift start much more easier, because the upper management tend to frown with us when we don't kind of write everything on the board. And so if you don't have a marker to write it on the board in the first place, your shift is going to kind of lag behind, because you'll be walking around looking for a marker, because you're trying to avoid yourself from getting into trouble, and because you need to update the plan for the patient on the board as well as to the family. So I always love keeping a marker with me. The next thing that you will always see nurses have is some pair of scissors. Like you can see, this is my name on it. This is probably the 4th or 5th pair of scissors. I have lost count at this point, but some nurses will tell you that they've probably had like 12, 20, because these things are very easy to lose. Take for example that you are in a code and they need to cut off a patient's shirt or clothing. Sometimes you will not even know where this pair of scissors went to. And so this is a pair of scissors in the case of an emergency and you want to have direct access to the patient's body or skin, especially when doing a code blue. This comes in very handy, the pair of scissors. Next thing I like to have on my list is going to be my staple and the staple pins itself. I don't know what this is called, but I love to always have extras. Sometimes I'm going to come to work and on the nursing station I cannot find the stapler to be able to clip all the brains of my 4 patients or 5 patients, depending on what unit I am on. So I love to always have my stapler, which I use to clip my brains together, so that I know that they are all one stack being held by a staple that have been, clipped. So I went ahead and got this from Walmart. I can't remember how much I got this, and I went ahead and picked up the staples as well, so that I can always have this handy when I don't find a stapler to use when I need it. Next thing on my list is going to be my pain medicine. I love to have my Eyewear very, very handy. Sometimes I go to work, maybe I didn't sleep enough, or sometimes I didn't sleep properly, or maybe I slept in a very poor position. And when I get to work, I probably have like a muscle ache or I have a headache. The Eyewear then comes in very handy. Sometimes even my co-workers will come ask me like, hey, does anyone have any pain medicine? And so I come in very handy to be able to give them some pain medicine. I got this from Walmart and it has 20 capsules in it. And tell you what, my co-worker was the one who even opened this for me in the first place, and since she opened it, I haven't yet used it, but I know that when I'm going to be in the position where I need it, is going to be available for me to go ahead and use it. So I love to always have my own personal items so that I can always reach out for it. I'm one of those people who believes in always having all that I'm going to need. I don't want to say I hate to ask or I hate to beg. I'm that person that if I know that I'm going to need something, I just go ahead and buy it and keep it for my own personal use. So I know that if I need it, I can just go ahead and get it. I also have Imodium if for any reason I eat something and my stomach, and I have a stomach upset, or I have to go to the restroom multiple times, or my bowel movement is kind of soft, I know to just get one capsule and I know the issue is fixed. So I always like to have my own personal medications on me. The next thing I always like to have is my pulse oximeter. Now, this is used to measure the patient's heart rate as well as the patient's oxygen saturation. Oxygen saturation in the sense that you want to know how much oxygen the patient is having in their blood. Now, on my step-down unit floor where all the patients are being hooked to a monitor machine, it's kind of like needless. But when I am sent to the ED, or when I am sent to the med-surg floor, or when I'm sent to the orthopedics floor where the patients are not all hooked to the monitor machine, and if I should walk into a patient's room and the patient seems to be in like respiratory distress, the first thing I want to know is what is their oxygen saturation. So I just pull out these and I quickly know what the oxygen saturations are. So I always like to have my own equipment for quick access, for quick assessment of the patient, and to quickly know what is going on my patient. So this is my pulse oximeter that I use to know what my patient's oxygen and heart rate is like. The next thing on my list is going to be my own personal mask. This is not me advertising this company. Evo mask has been a mask that I can vouch for, and I love it so much. I have been using this mask, not necessarily this particular one because this is the second one I am getting from this company, but I have been using this reusable mask for 3 years now. Pretty much for my entire nursing career, I've been using this for like 3 years plus. So this is the second one, and as you know, this is an N95 mask. I love this mask because of this cushiony part of it. As you can see, it is very gel-like. It is very comfortable and very soothing on the nose. You know how the other N95 masks have that metal part that kind of press onto the bridge of the nose. I feel uncomfortable with that one, and so I went ahead and bought this. And I got this when COVID was still at its peak, and I felt very uncomfortable when I was coming to work and I had to wear that mask for like 12 hours, 13 hours for my entire shift. It was just so uncomfortable. And so when I saw this on my preceptor, she encouraged me to go ahead and get this mask, and I can tell you it has been an amazing purchase. I don't regret my purchase. So the Envo mask. The next thing on my list is going to be my personal feminine sanitary or hygiene purse. So in this purse, I love to have my extra personal stuff in it, my tampon and my panty liner, as well as a sanitary pad. So I like to have an extra sanitary pad, panty liner, as well as some tampons in it, because you never know when your period is going to come. You never know when you could be embarrassed because of your feminine cycle. So I always like to have it handy. Sometimes I have had other nurses who have asked me, believe it or not, some nurses will come to me and ask me if I have a spare one, and so I always love to have it handy. When I have used it and I see or notice that it is almost done, I come home and I replenish it. So you will never catch me unawares without extra sanitary pads, panty liner and tampons in this my hygiene bag. So this is one thing that I love to always make sure that I have it in my bag. Next, it might be a little bit extra, but this is just me. I love to also always have a spray. It might not be this particular scent, but I always love to have a spray, especially when you finish cleaning a patient's number 2. The room is always very stinky. Sometimes even when you would empty the trash after you've cleaned the patient, the smell still lingers in the patient's room, and so I always love to use this in the patient's room. I just spray it in the room and spray it in the hallway, and that takes care of the bowel movement or the number 2 smell in the patient's room. And sometimes I feel like I don't want the patient to stay in the room of their bowel movement smell, and so I just go ahead and spray this. Sometimes if I'm not helping to clean the patient, the techs are going to go ahead and put in some ground coffee in the patient's room just to absorb the smell. But if I am cleaning the patient, especially if it's my patient, I love to always use this spray in the patient's room. The next thing on my list is going to be a clipboard. A clipboard is very, very handy, especially if you walk into a patient's room and you're getting your report and there is no surface for you to write on. So a clipboard comes in very handy when you have to get a report from the nurse and you need a surface to be able to take down your report on your brain during the bedside shift change. The next thing on the list is going to be this card holder. I love the fact that this is very extendable because it makes it very easy for you to be able to, badge into the computer and be able to skip the part of typing in your password. So when this is extendable or when this draws out like this, it makes it very convenient for you to be able to easily just badge into a computer, a wide or a rover or however you guys call it in your hospital. So I love this. And nurses have become so expressive in the different kind of badges that they use, and this is kind of like a stethoscope in the form of the heart reading. So this is very, very convenient to have as a nurse, because as a nurse we're always badging into the computer to document maybe a patient's output of urine, or maybe a patient's output of maybe an NG tube or a Foley or something, or you're now coming to document your assessment, or you're coming out to document maybe the patient's pain assessment or something that you know that you have to actively put it into the computer. So we are constantly badging in and out, and so it is just very, very convenient to have this really extend this long. Next thing on the list, which is very, very important, is knowing what color tubes to use for what labs. And so this is it all listed here on my badge. So this makes it very easy, especially if the patient has like a central line, and especially if your hospital doesn't have phlebotomies, or especially if you are an ICU nurse and you have to be the one to draw your labs. So this is very, very easy. You know that if you have to do a CBC, you have to get a purple. If you have to do a heparin, you have to get a blue. If you have to do a lactic acid, you have to get a gray. So especially for the new nurses, this is going to be very easy, very convenient for you, especially when you have to be the one to draw your labs. So there is so many of these things on Amazon. This one explains to you how to do an EKG. As you can see, this is the same thing at the back here. For an EKG, if you don't know how to place the leads for an EKG, this comes in very easy. It's very explanatory, as you can see it here. And I always advise new nurses to get these cards from Amazon. They are very affordable, and they're all on Amazon. So go ahead and get these. I will tell you that even experienced nurses have this. I will tell you that my charge nurses do have this handy. So you are not out of line if you're just 4 years, 5 years, in 7 years to be having these on your badge. And you can see how this is very convenient on my badge. Next thing on my list is going to be a planner. I love to have a planner. I am a very, very organized person, in the sense that with this planner, I use it to organize my month, I use it to organize my week, and I use it to organize my day. And so when I write things in here, it makes me to easily know that, okay, this week, this is what I have to look out for, this is what I have to do, these are the goals, or these are the things I have to accomplish. It makes me not to forget what I have planned to do. If there is any appointment, if there is any bills or payments that I have to do, I always write them down in here. As I pay off my debts, my loans, I always write them in here so that I know how much is left and how much more longer I have to be able to clear off those debts. So a planner really comes in very, very handy. I don't only plan for that month, I can go ahead and plan for like the next month, or 2 months ahead, or 3 months ahead. I just go ahead and write the very important occasions, appointments, or things that I have to be part of, so that I don't forget them. So a planner is very, very important for me. I am one of those people that if I have to remember something, I have to write it down. And so if I don't write it down, most of the times I will not remember it. So if I open this planner, it is full. Like, as you can tell, it is really old. I have things written in it if you cannot see. And so yeah, I always like to keep appointments and whatever is important to me, I always write it down in my planner. And that is how I have been able to successfully keep myself organized as a nurse. And I'm going to urge even nursing students to go ahead and get a planner for themselves. You open the monthly calendar part of it and you write, hey, I have my exams on this day, I have this thing to do on this day, and that will keep you so organized. So a planner is one of those things that nurses, I think, should have to keep themselves organized. The next thing on the list is going to be a smartwatch. For me, the only reason why I have my smartwatch is because I want to keep track of how many steps I walk in a shift. I can tell you that if I'm walking on the med-surg floor, I probably walk a lot. But if I'm walking on my step-down unit, just because we have the monitors in the patient room and we have a monitor at the nursing station, it is very easy for you to be able to monitor your patients while sitting in the nursing station. But on the med-surg floor, you don't even know what is going on. So you have to constantly be going and checking your patients in their room and making sure that you know what is happening at every time or every given time of your shift. And so the smartwatch comes in handy for me to be able to know how many steps, how many calories, how much water I've drank for that shift, as well as telling me how much I need to sleep. This smartwatch also will tell me what my heart rate is. It's also going to tell me what my respiration rate is. And so that is one thing that I love about this smartwatch. So yeah, that is the only reason why I have a smartwatch. I would rather prefer like an analog watch, especially if I have to do a manual counting of a patient's respirations. A manual watch comes in very handy, or I might use my phone and use a timer to be able to count my patient's respiration. So smartwatch just to know how much I'm walking, if I want to know what my heart rate looks like, my respirations look like. But if I need to be able to count a patient's respiration or something that needs me to time it, I just go ahead and use my mobile phone for that aspect. Now the next on my list is going to be like a hand cream. This is the smaller version. I think I left the bigger one in my house, and so I'm going to be using this smaller version to show you guys. I love when my hands are moisturized. I am one of those nurses who uses a hand sanitizer like crazy, especially if I'm just cleaning a patient, especially if I'm walking out of a patient's room. I use that hand sanitizer like crazy. And so when I step out of that patient's room, the very next thing after I've washed my hands or using the hand sanitizer that I reach out for is going to be my hand cream. I love when my hands feel moisturized, they feel very supple, they feel very not cakey, not dry, and so I always have my hand cream for that purpose. The next thing in my bag is obviously going to be my lip balm. I hate when I have dry, cracked lips, and so my Carmex lip balm always comes in very handy. As a matter of fact, let me do it right now because I feel like my lips look very cracked and charred. The next thing on my list is going to be some medical apps which are on my phone. The most popular app that most nurses use is called Medscape. There's so many other apps out there, but Medscape seems to be the one that most nurses have. You want to be able to know what a medication is, what are the contraindications, what are the side effects of the medication. If the medication can tamper with blood pressure, you want to hold it. If you can tamper with maybe the blood sugar of a patient, you will hold it. If you can tamper with the potassium, you know that is one of the labs to look out for. Just, checking out to see what a medication is, checking out to see, they said the patient had a Minnesota tube, what the hell is that? You can go ahead and look at different procedures, you can go ahead and look at different medical diagnoses. If for some reason you don't know what acute CHF is, you can go ahead and look at it. Congestive heart failure, the signs and symptoms to monitor in a patient, the things to look out for, the labs to look out for, maybe the medications that you should be anticipating that the provider is going to put in for the patient. Maybe a patient is hypotensive and for some reason you're like, okay, what other thing can we use to help this patient's blood pressure? You can look it up there. It's going to tell you, hey, you can try Proamantine or Midodrine, or you can try bolusing the patient. So the Medscape app is very, very handy in terms of letting us know what we need to be able to better care for our patients. It's going to explain to us diagnosis, medications, side effects to look out for, maybe the labs to look out for a patient, and an overall sense of what the patient is in the hospital for and how to better care for them. The next thing on the list is going to be a lunch bag. Obviously, there's no way you're going to go for a 12-hour shift and you're not going to take lunch to work. And so you want to have like an insulated lunch bag. Either ways, you can get an insulated lunch bag, or a lunch bag is still okay, because worst case scenario, you're going to put it in the refrigerator, and when it's time for you to eat, you're going to heat it up. So insulated or not, you just need a lunch bag that you'll be able to take your food for your 12-hour shift when it's time for you to take your break. So a lunch bag comes in very, very handy, and it's very, very important, especially because you need that energy to energize yourself in between that 12 hours shift. The next thing on my list is a water bottle or a cup for you to be able to hydrate yourself. I don't care whether it's a Stanley cup, I don't care whether it's a Yeti cup, I don't care what sort of cup it is, but you just need some sort of a container that is going to keep you hydrated as you work on your 12-hour shift. So a water bottle is very, very important, because guess what? If you're not hydrating yourself, your pee is going to become very concentrated. It's going to damage your kidneys. When you're dehydrated, you're going to be having those headaches. You might become nauseous, and there's just so many things that can go wrong with you. So you want to make sure that you're hydrating yourself. Get yourself a water bottle, or you can get yourself an insulated cup or a regular cup. It doesn't matter, and keep yourself hydrated whilst you're working that 12-hour shift at work. The most important and the longest aspect of our job as a nurse is sitting in front of a computer, and so most nurses would love to have a blue light blocking glasses just to prevent their eyesight from being damaged by the light that comes from the computer. I can tell you that as a nurse, we spend a lot of time in front of the computer, and so if that is something that is going to be an issue for you, I know so many nurses that have extra glasses just for when they are seated in front of the computer, and after they're out of the computer, they don't wear glasses. So make sure that you're taking care of your eyes. These are actually medical or prescribed glasses, and so I don't wear these glasses for that purpose, but I can tell you that these glasses have the blue ray blocking, or whatever it is called, screen or film on the glasses itself to be able to prevent that blue ray light from damaging my eyes. So that is another very important aspect that most nurses would love to have as extra glasses in their backpack. Another important thing that you would also want to have is a jacket, because let me tell you guys, the hospital is so cold. I am someone who is very sensitive to cold, and so I always do not miss taking a jacket to work. Whether it is summer, whether it is winter, I always take a jacket to work. And so whether it is winter or summer, or whether you're cold sensitive or not, I always say take a jacket to work, because the hospitals are meant to be cold, just because they want to keep the environment looking fresh, especially the medications, and especially maybe some certain procedures that will prefer that kind of environment. So always have an extra jacket with you, because you're going to be so uncomfortable if you don't have a jacket and you're so cold whilst at work. Another thing too that I always like to have at work are my AirPods. Look, we all know that as nurses there is downtime, and there is time when you've probably done everything that you have to do, and you just want to like have some moments with you. Or why not during your lunch break time, you want to be eating and you're listening to music, or you're watching a video, or you're talking to your family and you don't want anyone eavesdropping, or you just want to multitask while you're on the phone and you are also answering a call. You want to always have maybe AirPods, or you want to have headphones handy with you, because this is very important to me. I feel like I cannot do without my AirPods when I go to work. So AirPods for me are very necessary when I have to go to work. The last and important thing that some nurses will have in their backpacks are books. Some nurses, especially the older nurses who are not very conversant with apps, they will tend to have books in their bags where they can turn to for reference for maybe some new procedure or some new medication. But for we the Gen Zs, or those of us who are very versed with apps, we most of the times will just go ahead and download an app for that purpose. But I can tell you that there's so many nurses who come to work with books that they can reference certain medical aspects, medications, procedures, diagnosis for a patient, and so that is their own way of going into that book to be able to find information regarding the care for their patient. Thank you so much for staying right up to the end of my video. I hope that especially the aspiring nursing students, as well as the new grad nurses have gathered something when it comes to what they should be expected to have or take with them to work. Some of these things, like I mentioned, might not be very necessary to you, but I'm going to tell you that I love to always have them with me, because that makes my own shift much more convenient for me. If this is your first time of stopping onto my channel, please do not forget to like, share and subscribe. And from me to you, I'll see you all in my next video. Bye guys, and stay safe.